Thank you, Senator. Thank you for having us this afternoon. Let me reintroduce again to you the members of the Health Task Force for District 38. Thank you for allowing us to come do this presentation to you. Our mission and purpose is good quality health care for the members of the District 38 community. Our mission is to support you, Senator Daphne Campbell, in the fight for quality, accessible health care through community outreach and proponents of legislative bills to improve each health care policy for the benefit of the constituents of District 38. We are currently working on the Human Trafficking and Health Caregivers Bill for the year 2018. I'm going to let the Health Advisor Jennifer Leslie talk on the Human Trafficking Bill, and I'm going to let the Communication Director Joanne Timo talk about the Caregivers Bill. Again, I am the Health Task Force Chair. My name is Dr. Catherine Takim. I have a doctorate degree from the University of Miami. I'm also a nurse practitioner by profession. I'm going to let my team members introduce themselves and let you know what their roles are in the Health Task Force team membership, and let you know again that we are working hard for you, for the community, and we're here to support you in all that you do.
Thank you. Welcome.
Good afternoon, everyone. My name is Marcel Rushan. I am a voice ambassador for child sexual abuse and human sex trafficking. My role is a vice chair of the Health Task Force for District 38, and I am also the community outreach liaison for District 38. I am very excited to be part of this great team, and I am looking forward to serve my community and the people in it. Thank you.
Thank you, Ms. Marcel.
Good afternoon, everyone. Good afternoon, Senator Campbell. My name is Eugénie Montpremier. First of all, I'm a trainer in abuse and first responder in abuse as well. And I have a degree in business administration, constitution management. I'm a travel agent as well, communications. And therefore, I work with children as a community liaison. And this year, I'm happy to be part of District 38, assist Marcel Rushan regarding human trafficking. When people talk about human trafficking, for me, this is my baby, because everything affects children or women, because I'm a woman coordinator as well, therefore I feel concerned. And therefore I said, thank you for inviting me to that great organizations, and therefore Marcel and I, we are going, with God power, we're going to do what we can do for the community, educating them about human trafficking. Thank you.
Thank you, Ms. Eugene, for being a part of the family, District 38.
Hello, everyone. My name is Joanne Timo. I am a commercial real estate property accountant. I have a degree in communications and marketing. I am a part of the legislative committee for Senator Daphne Campbell's District 38 Healthcare Task Force. I double as the communication director for all media-related publications. Thank you for having me.
Thank you, Ms. Joanne, for being a part of the family, District 38.
Good afternoon, everyone, and good afternoon, Senator Daphne Campbell. My name is Adeyinka Bolarin. I'm a nurse. I'm a registered nurse. I'm also have a master's in education. I'm an adjunct faculty right now at university, and also a president of Law Shepherd International Women Empowerment. I'm a part of research committee for Healthcare Task Force. I'm here to support, to do as much as we can do to help people in our community. Thank you.
Thank you for being a part of the family as well, District 38.
My name is Jennifer Leslie. I am Senate Health Advisor for District 38. I have a Bachelor of Science degree in nursing from Florida International University, a Master of Public Health degree from Florida International University, and a Juris Doctor degree from University of Miami School of Law. I'll now pass this on to Joanne Timo, who is going to talk about the Family Caregiver Support Bill.
Thank you, Ms. Jennifer, for being such a great chairperson, now a great advisor for District 38 Healthcare Task Force. I know you are doing such an amazing job, and I thank you from the bottom of my heart. You are my sister, my friend, my friend, my true friend. So I love you.
Thank you.
Hello, everyone. I want to give a little insight regarding the Family Caregiver Support Bill and a little bit of research along with it. 40 million Americans care for a disabled family member every day at a value that is estimated to be about 470 billion annually. The lost wages to family caregiving exacerbates the poverty gap and gender gap in America. Because families have to sacrifice their income to unpaid caregiving, also, caregivers are the mostly important women. Family caregivers' opportunities for a paid, productive life could reduce the economic burden of caring for a disabled family member. The Florida Senate District 38 Healthcare Task Force proposes legislative incentives to businesses and organizations who employ caregivers. Thank you.
Awesome.
I'll now pass it back to Jennifer Leslie.
Awesome. Well, Honorable Senator Daphne Campbell, thank you for graciously embracing us here today. Over the past few weeks, the entire nation has become engaged in a discussion on sexual harassment. At the same time, the problem of sex trafficking continues to go rampant throughout our poor neighborhoods and contaminate our underserved communities. As Senate Health Advisor for District 38, I firmly believe that this sex trafficking discussion cannot be excluded from our current discussion on sexual harassment. Thousands of people are trafficked and forced into commercial sex work every year, and they're treated in the emergency room. ER clinicians, we know, can help to identify these victims and bring them to safety. So we are currently working on a bill. Thank you so much for working with us on this human trafficking bill. Sex trafficking is not just a District 38 problem, though. It's not just a Florida problem or a national problem. It is a healthcare problem. And in our profession, you know, when we act, we save lives.
Correct.
And so therefore, our doctoral research recommendations committee has designed a simple survey for each emergency room. You're already aware of that survey, and we're currently distributing those surveys throughout the emergency rooms within South Florida. Thank you for the opportunity to talk on this topic.
Thank you, Ms. Jennifer. What?
Senator, this is your Health Task Force team members. I apologize for those people that could not make it here today, but we have a big group of people to present to you. We would want you to say a little something to these team members that are here to support and back you up in whatever health information that you have to bring from Tallahassee.
Well, guys, I'm so. What?
Oh, yeah.
First, guys, let me say, correct? Can I start? You can put them on the floor. That's fine. Give it to me. Can I start? Okay, guys, let me say thank you to Dr. Tekim first for being the chair of the Healthcare Task Force. I know when I make the changes and put Ms. Jennifer Townsend, Jennifer Leslie now, as an advisor for the Healthcare Task Force of District 38, and choose you as a chair, and right away you say thank you. You say yes. You didn't give me a day to wait, an hour to wait, a minute to wait, and you said yes right away. I thank you from the bottom of my heart. I do know District 38, the constituency I serve, 500,000, no, not 500,000, 500 people, 500,000. I do serve, say thank you to you. I do know with your professions, with the background of healthcare you have, you're going to bring a lot on the table for District 38. I do know whatever research your team is making or proposing, going to be the right thing to do, not only for the state of Florida, it will be for the entire nation. I thank you. And I will say to you, from the community I serve, thank you too. And the rest of the people, Jennifer, as an advisor, she knows already. And I don't have to even say anything. She's been a chairperson I was a state representative, 6 years. Now was a chair for the Senate as a First Nation senator in the state of Florida. And now she got another hat, be an advisor. Jennifer, I said thank you. To the other team, Marcel Rushan, Joanne Timoth, Adehenka Abolarin, Eugenice Mopremier, to all of you, whatever your position, vice chair, or communication director, or advisor, or, special, like a task for research, whatever it is, community outreach. I say thank you to all of you. District 38, like I said earlier, I represent 500, like 500,000 people for the district. And it's a diverse district where we have high class, moderate class, no class, or low class. So I represent different ethnicities. So my role as a first-time senator, and I spent a year already in Tallahassee, I could tell you, with you guys' help, with you guys' support, as a registered nurse background myself, I could say to you, my first year was very successful because of you. So I thank you guys. I thank all of you from the bottom of my heart. My staff, thank you. The community I serve, thank you. The District 38, thank you. And the state of Florida, with over 20 million people, thank you guys. I heard the 3 bills you guys presented to me. I put them in bill drafting already. They are in bill drafting. My staff called me yesterday. They are in bill drafting. And I could ask one of my staff to bring them to me right now. They sent them to me since Monday for review. I didn't have a chance to review them. Liz, can you please pull out for me on ledges the 3 bills? One is human trafficking, the other one is
Family caregivers.
Family caregivers support. They did send to me and it's in ledges. Can you pull them and bring them to me because they sent them to me for review. Pull them for me right now. And I could tell you my staff, I do have 3 staff. I have Latoya Shields, Elizabeth Honoritz, Marie Eliancy. There are 3 staff who work tirelessly for the community. Tirelessly to respond to 12 task forces I created since I became the first senator for Haitian community. So I don't represent Haitian only, let me make it clear. I do represent the Jewish community, the Black American community, the Jamaican, the Nigerian, they know that, the African people, so Hispanic, and it's like I said, it's diverse. Indian, and in Tallahassee right now, I have resolution for the Indian community, I have resolution for the Nigerian, I have for African, and I do have one first time ever for the Jewish community. They're going to have a week in Tallahassee next year and a week with the children. So we're working very hard to make sure everybody is well served, well represented. It's not about the color, it's not about where you're from, it's about who you are and how can you represent the people who stood for hours in line to vote for you. That's what I do. I am Haitian, very proud to be Haitian. First Haitian in the state of Florida, but that don't mean nothing. My heart is to serve every ethnicity the District 38, encompasses. So I could tell you in Tallahassee right now, and they're gonna bring me the 2 bills you guys presented to me, already drafted, I said. I have to review them and file them. I could tell you since 2010 being a state representative in the state of Florida and the healthcare task force, while I was a state representative, they presented to me 2 bills. The Baker Act for nurse practitioners and physician assistants. They did bring to me again another bill for nurse practitioners to prescribe controlled substances. So, and physician assistants. That one passes last year. After 50 years, these nurse practitioners been fighting in the state of Florida, and Florida was only one state left, and that passes. I was a part of it. And now, we still have to fight. The fight just started because the other bill, the task force did give me 2010, the Baker Act for nurse practitioners and PAs. PAs could Baker Act because the Supreme Court ruled them it was by rule, but not by statute. And that bill been there since 2010, passes every year in the House unanimously, failed in the Senate. And last session, I had it myself, passes every committee and stuck on the floor. 7 full years. And the bill is a very simple bill. It says here, an act relating to involuntary examinations under the Baker Act, amending statute 394.455, Florida statute, defining terms, amending statute 394.463, Florida statute, authorizing physician assistants and advanced registered nurse practitioners to execute a certificate under certain conditions, stating that they have examined a person and find the person appears to meet the criteria for involuntary examination, amending statute 39.407, 3994, I don't have to say all of them. The bottom line is a very simple bill which says, if a person come to a nurse practitioner and say, I want to commit suicide, the nurse practitioners could right away do something. But the statute, the current statute right now, allowing social workers, registered nurses who work on the floor with psychiatric ward, doctors, police could Baker Act except ARNPs and PAs. Do you think it's fair? Florida is the only state nurse practitioners and PAs cannot Baker Act. The bill has been in Tallahassee for 7 years. And I filed it again for next session, 2018. I'm hoping after 8 years that bill turned to law. Once this bill turned to law, I want all of you to come to Tallahassee the healthcare task force, every one of you to take time, of your busy time, to come and celebrate, because this bill belongs to District 108 to District 38 Healthcare Task Force. Baker Act. You guys need to celebrate. Celebrate, and that started from Jennifer Leslie. 1000 first, not Leslie second. This is started from the task force. She did represent as a chair. They bring it on the table because they figure Florida nurse practitioners should Baker Act. They don't understand why Florida is the only state. I don't understand Florida always left behind, always the last one to act. Can you imagine a nurse practitioners or a PA working alone in an ER or urban rural or urban area, let me put it that way, alone, and a patient walked in, extremely depressed, maybe problem with husband, or maybe husband or wife, losing homes, to have no jobs, kids problems, problems here, problems there, and the problem all went to here, so they cannot take it no more. But they have a beautiful handbag, but inside the handbag have a gun. And they came to here, the nurse practitioners alone, and said, nurse, I can't take it no more. I want to commit suicide. That nurse practitioners can do nothing than pick up a phone and call police. The police now is busy making an arrest to someone who robbed somewhere or who committed a very big crime. Say to the nurse practitioner, I am busy, but I'm coming, but I will be there in 4 hours. What do you think happened to that poor nurse? She didn't have no warrants to open that patient's bag or purse, whatever. She didn't have that. So now, the patient cannot take it no more, open that bag and kill the nurse first and kill herself. That's exactly what's happening. And we have a lot of nurses who came to Tallahassee and testified these things happen. And still my colleagues can understand to say, let's have this bill turned to law, and these nurse practitioners will have tools to work. Because if you don't have the tools to work, you pay for it. And these nurse practitioners work in an environment where if they don't protect themselves, or if they're not well protected, let me put it that way, that's not good. So it's very important we voice for what is right for the state of Florida, for the benefit or well-being of the people. So I commended you guys for whatever you guys doing, because you are working for the people. And your job is more accountable than my job, because you don't get paid for anything. You're doing a volunteer work, which is more important than anything else. But God will reward you for everything you do. So let's work it. Let's do a very strong campaigning to make sure this bill is carrying on next session. And I'm waiting on the 2 bills. I got them right now. The 2 bills you guys give me. Family caregiver bill. I have it here. I will pass it on to you guys. They sent it to me for me to file it. I'm going to read it, and I will pass it to you guys to read it to see if it's okay, because that's you guys' bill. Can you guys bring, Madam Chair? Look at it, that's one of them. Once you guys give me okay, I will file the bill, and it will be a bill where we're going to fight to present it on in committee and from committee, and talk to my colleagues to make District 38, Senate 38 have their own bill in Tallahassee. But you guys have to come to Tallahassee to advocate for your own bill. And let me go back. I have another bill here. It's for delivery of nursing services, which is these nurses been fighting for the longest to make sure so we have enough nurse working with the patient, which is nurses ratio. So this is a fight in Tallahassee, but never heard. They never want to hear the bill, but we're still working on it. And like I said, too, I could talk to Eugénisme Premier. I heard a passion for human trafficking, and I heard, you know, Miss Leslie, you know, about the same thing for human trafficking is a part of healthcare.
And Marcel?
Yes. So if you guys remember, I have it with me. Senate Bill 852. I was a co-sponsor with Senator Rene Garcia last session, which is a law now. This is a bill. It's a student that bring it to Rene, who wants the school to teach the student the signs of human trafficking, and this is the law now, and they're going to bring that up in school, and you don't have to worry. I was part of it. Okay, I am a co-sponsor of SB 858. I will pass it on to you, but it's already law. Governor Scott signed it to law since a few months ago, so we have that in school. So SB 858, human trafficking. So the next bill I will tell you guys I'm working on is a kid care.
What about the foreign physicians?
I'm going to come on that. So I have a bill now for Florida Kid Care Program, which is a part of healthcare as well. You guys know what is going on. President Trump, you know, is messing around with our kids. So I bring the kids care program in Tallahassee just to make sure we try to create a task force to control what is going on for the kid care program. It passes one committee, and I'm hoping it goes to second committee and we get that done. But I could tell you guys, you got the true voice, my voice. You got the true champion, your Senator Daphne Campbell. And I am with you guys' support and your help, I could do a lot. There's no way I could work alone by myself. I do have colleagues. Remember, in the Senate we have 40 senators. 29 included me make 40. In the House we have 120 members. Any bills to turn to law have to be in both chambers, House and Senate. So the bill draft, the two bills you guys give me, I give them to Representative Roy Otterman to put it in bill drafting as well. So once I file mine, he will file his. So we could just get them referred to committee, and once he referred to committee, and if they agenda the bill, I will let you guys know you all could participate, engage with what's going on. And I'm getting you guys the second bill you guys give me, which is, where's the second bill? They have another bill for human trafficking. That's Senate District 38. Okay, the other bill she just passed me is for me to help the foreign trained physicians. You guys know we have a lot of doctors from different countries. They all doctors for 15, 20, 25 years, coming to state of Florida.
That's our bill too, since 108.
Okay, that was a bill from 108 as well. It is true. So District 108 did bring me that bill for foreign trained physicians. We have a lot of doctors from Africa, from Nigeria, from Haiti, from all over the world who came here and they cannot practice as a doctor. It's a very sad story. When I saw so many doctors I met at the airport working, cleaning the airport. Some of them work in the cafeteria. Some of them working as a security. Some of them went back to school as a HHA, home health aide. Some of them working as a CNA. Don't you think it's sad after 25 years being a doctor? This is why we're here for? No. As a policymaker, I think that's the right thing to do. to voice for the voiceless. These doctors are voiceless. That's why I have this bill in Tallahassee for 4 years now. I have it 3 years in the House and 1 year in the Senate. And I'm working diligently, tirelessly with my colleagues, Republicans. And in the House, the sponsor is a Republican. Mine it is. I am the Senate sponsor. So I'm working tirelessly to see what can we do, which policy we could put in place for these doctors to do their work as a doctor. When you go to school to become a doctor, and you spend days and nights, you spend money, your time. Some of them are family members, like when I say family, some of them are husband and wife, children, and you sacrifice yourself to become a doctor, working 25 years in your country, coming to the land, and you think it's a land of prosperity, or land to do better, a land, they call it sweet home, a land of opportunity, and you come here and all your opportunity just cut, and it's a different angle where you have to work. I don't say the work they're doing is a bad work, because everybody do work in your own capacity. But being a doctor for 25 years, guys, let's be real. Regardless where you're from, you think you should come here to work and do cleaning job? Do you think it's fair? A doctor for 25 years, 10 years, 15 years? You don't think it's sad? I think it's sad. Because I have my daughter is a doctor. I am not saying I want them to be a doctor without going to proper channels where, you know, those kids who born here, who studied here. And not only that, the bill is not for people who come from just outside of state of Florida. We have people born in Florida who went and study medical outside of Florida because it's cheaper. So they call them medical trained or foreign trained physician. So this is another bill I want you guys to really do a lot of research, because the study says 2020 we're going to be short of a lot of doctors. Healthcare right now is in jeopardy. You hear what's going on in Washington, D.C. They want to repeal Obamacare. You hear, you know, Florida is one of the states who refuse Medicaid expansion. You hear so many things about healthcare. So if we do have a shortage of a bunch of doctors, what do you think will happen to the patients? I don't think we need this. That's the main reason we do need to make a tour of every hospital in District 38 to expose the situation, to ask them for their support, to make them engaged, because it's not only getting money for the patient, it's giving the quality care to the patients. How you do that is a participation, collaboration, and one-to-one or side-by-side. Correct? Yes. So I'm asking you guys to really, we're going to work hard. We're going to work hard to make a difference. We're going to go outside of Florida to reach out to nursing students who in like a 40 years degrees, bachelor degree, bring them to show them how here works, or bring them to simulation lab. UN just opened the first simulation, you know, a hospital ever in the state of Florida. So we're going to reach out to Haiti, Africa, Jamaica, Nigeria, you know what I mean, go and get them, Trinidad, but you know, I could start calling all of them, Guyana, and get the nurses and bring them here to see how nurses operate in US, and we could do like an exchange program to teach them, to educate them. We could even go as a healthcare task force, reach out to education task force as well, to see if we could bring the kids from middle school, high school, to make sure these kids knows the hands-on on how America works. So when they come here, they don't feel like it's a strange thing for them. So I commend every one of you for the work you do, for the participation, for your time, for your efforts, for your busy, busy time, because I know a lot of you, all of you working and leave today to present to me your 2 bills where I already have it in drafting and you just have to review them. Give me your thought about it, your concern, or if it's okay. Once you guys tell me, yes, I will press the button and file it, and it will be District 38, Senate 38, Healthcare Task Force.
Yay!
All right. May God bless each one of you. May God bless your family. I will pass the mic to the advisor of Senate 38, District 38, Healthcare Task Force, Jennifer Leslie.
Okay, so this meeting has come to a close. We're still live here with Senator Daphne Campbell at Florida Senate District 38 office, Senator Daphne Campbell's office, with the entire Health Task Force members. Well, some of them are not really here. So let's review the names again. Dr. Dickem, Dr. Catherine Dickem, Marcel Rochon, Eugenius Momprier, Joan Thimot, and your name is a little bit difficult. I know you as Yinka, and I'm going to leave that that way. And my name is Jennifer Leslie again. Before we close, I want to thank our lovely videographer. His name is Lou. Okay, thank you. You've done a wonderful job. And thank you very much to your staff, Miss Marie and Nancy, and thank you, Miss Elizabeth Honorat, wherever you are, Chief of Staff, for all of the work that you have done. You've all worked tirelessly to put this all together for this meeting today, for this tour that we had today, and for all of the research activities and all of the presentation that we've made today. We thank you all wholeheartedly. We don't take this lightly.
Don't close yet. Don't close yet, please.
Second.
Don't close yet.
Every minute.
Don't close yet. I have a good news. Don't close that. Come on. Can I get this? Okay.
Hold on.
Breaking news. Breaking news. Breaking news. Breaking news. Come on. Listen to the news. November 30th, 2000 is from Miami-Dade County Legislative Delegation. November 30th, 2017, Miami-Dade Legislative Delegation. Regarding Miami-Dade Delegation appointment to the Haitian Temporary Status Relief Task Force. Dear delegation members, I, Keone Maggie, as chairman of the Miami-Dade County Legislative Delegation, would like to appoint Senator Daphne Campbell to serve as chair and Senator Rene Garcia to serve as vice chair of the newly created Haitian Temporary Status Relief Task Force. Thank you, and feel free to contact me whenever. Keone Maggie! Can you guys say something about it? Now you guys will open the newly elected chair, Senator Daphne Campbell. You have to say something now. I'm not gonna finish.
It has to be you, Senator Daphne Campbell, the superwoman, the hero, our great, honorable woman of District 38. It has to be you, no one else, because she's the only one that's been capable of getting TPS extended for 18 months. At least we have time to work
20 months.
on it from now. It's
20
18
months.
to 20 months, whatever, what difference does it make? But congratulations, you've done it, and keep fighting. We're so proud of you.
Thank you. Give it to them. Let them congratulate me. Oh.
Congratulations, Senator Daphne Campbell. You have been a wonderful senator in this community, and I'm very proud of you. Very, very proud of you.
Thank you.
And I'm here to support you. This is just the beginning.
Thank you.
Congratulations, Senator Daphne Campbell. Thank you for serving our state so gracefully and so well. I will support anything. I will continue to support any and every endeavor that you put your mind to. I know you'll get it done. Thank you so much. From Joanne.
All right.
Congratulations, Senator Campbell, and may the Lord continue to enlarge your path. This is just the beginning.
Amen.
Congratulations, Senator Campbell. From Marcel, I know I am a rookie in the team, but I am looking forward to work with you and serve my community. Congratulations.
Awesome.
Senator Campbell, we knew you would do it. You told us this morning it was a premonition and you got it through. Congratulations. The team is behind you in whatever way you want us to serve. Thank you.
All right. Okay, guys. So thank you very much for coming and thank you for everything. Everybody, thank you.
He says one more.